let's talk about mesothelioma. It's a relatively uncommon cancer, but there have been some real advances. And over the last few years, we've had the combination of immunotherapy agents, nivolumab, Opdivo with ipilimumab, Yervoy, that has been studied, shown to be better than chemotherapy alone, but particularly better than chemotherapy for the subset of patients with the uncommon, less common sarcomatoid variant of mesothelioma. This study, which was run in Canada and France and in Italy, looked at mesothelioma treatment with, it was initially a 3-armed phase 2 study of chemo with or without Keytruda or Keytruda alone. And then it evolved to a phase 3 study focusing just on the question of chemotherapy with or without Keytruda. And this was for mesothelioma with either epithelioid, the common or the most common variant, or sarcomatoid, less common. It looked at overall survival as the primary endpoint. And it did show a benefit for chemotherapy with Keytruda. And you could see the relative improvement was about 20% in overall survival. And this is statistically significant. That translates to a difference in about 8% in the overall survival at 3 years, favoring the arm that got chemotherapy with Keytruda. But it is notable, you know, we talked in some other settings about crossover and limited crossover. And here, most of the patients did not get immunotherapy after the first line setting if they didn't get it first line. And so some did, but not most. And we also see that the benefits, well, they were seen pretty broadly, but more in the older patients, older than 65, than in those younger than 65. And a very substantial benefit in the patients with non-epithelioid or sarcomatoid histology, less convincing for those with the more common epithelioid variant. So really just a question of, in a world where we have immunotherapy available, we have chemotherapy available, we can sequence them, and we generally do. I think most of the time we might have head scratching about whether we'd favor one followed by the other and which one, but we would generally want to give both. I don't know that this is, to me, that compelling to combine them over doing it sequentially. Alfredo, what are your takes about this? What does this teach us now when we have a real world comparison of being able to do chemo, maybe with Avastin as well, which also improves outcomes, but isn't that commonly used. But, you know, we have a chemo-based approach. We have an immune therapy approach. We can do them sequentially. I don't know that we need to do them concurrently like this, at least. What are your thoughts?
Yeah, that's a good point. To be honest, this is a very interesting study. And to be honest, I was hoping to see a better signal for epithelioid. For non-epithelial sarcomatoid, as you said, I think giving immunotherapy, I think on its own, I think is a no-brainer. So I don't think I would consider to add chemotherapy up front for several reasons. It works very well. You might have long-term response. For the epithelioid, though, even in the study that was published, the signal was not as good as sarcomatoid, though I would still use the immunotherapy on its own. There's a lot of question whether maybe with chemotherapy, as you mentioned, and Avastin, you might get, you know, similar results to what you would get with the ipilimumab and nivolumab up front. So I was really hoping that for the epithelioid, by combining chemo with immuno, we might get a better signal, which I don't see. So I'm a bit disappointed. I'm just, you know, hoping to see better results with the ongoing study. But at the moment, I agree with you. I wouldn't change my practice. I don't think for the epithelioid, I would use chemo and immunotherapy based on this data.
Christine, what are your take-home messages for this relative to what we already have?
I agree with Alfredo. I don't really have too much else to add.
Okay, great. Well, I want to thank you both for your great comments about this work, but about so many of the trials we discussed, including some hairy issues, some head scratching challenges, and it's very helpful to have you both offer your frank discussion, your perspective of questions that we still don't have answers to, and hope to know more in the future. So, thank you both so much for joining us today.
Thank you for having us, Jack.
Yeah, thank you very much for having us. It was fun.